On this episode of Shareable Science Beyond the Blog, we're going to talk about how COVID-19 spreads and ways to reduce your risk of developing the disease. We've got a lot of ground to cover, so stay tuned.
Welcome to Shareable Science. Science you can share.
Let's talk about how COVID-19 spreads and what you can do to reduce your risk. There are two primary ways that COVID-19 actually spreads, the primary one being in respiratory droplets. So those are little droplets of liquid and mucus or snot that actually contain the virus that individuals who are infected with the coronavirus breathe out, sneeze out, or cough out. And these respiratory droplets actually can fly up to 6 feet through the air and then land within that distance, land in someone's nose or in their mouth, or actually inhale them into their lungs. I know that that's a little bit gross, but that's the reality of what we're talking about. 6 feet. Let's talk about what 6 feet. Let me show you what 6 feet actually looks like, because I think for most of us, it's longer than we actually would have anticipated. Okay, that is 6 feet from my mouth. Let's go this way, right towards our cameraman, Chris. 6 feet. That's a lot of distance. That's why when we talk about social distancing, we talk about 6 feet between individuals, so you are outside the snot spray shower. All right, the other way is by surface exposure. We think that this is less likely, but an individual who's affected, if they cough or sneeze, those respiratory droplets can land on surfaces. And then if you come along right behind that and touch that, transfer it to your fingers, you cannot get COVID-19 through your skin, but if you transfer it to your mouth or nose, your mucous membranes, then it can get into your system and infect your cells. A paper came out a few days ago in the New England Journal of Medicine. You can actually get to it. It's not behind a paywall if you want to dig deeper into the data, that actually looked at how long the virus was detectable on different surfaces. And you can see anywhere from 3 hours when they nebulized it up into the air, all the way to 2 to 3 days on plastic and stainless steel surfaces. So before you put yourself in a bubble, let's put some caveats around this. Almost immediately, the number of viruses, the level of viruses began dropping. So every hour, there were fewer and fewer detectable viruses. The second piece is that the researchers didn't take another step of taking the virus that was remaining, that was still detectable, and seeing if it was infectious, if it could actually infect cells. So the virus was still present, but whether it was able to carry out its job was not something that these researchers looked at. Nevertheless, it can stick around on surfaces. So as we think about ways to reduce our risk and prevent our exposure, we want to keep that in mind. Number one, you all know this. You have heard this song 16, 20 different times. Social distancing. Keep our space. Remember the 6 feet snot spray. This is especially important for those folks that are at high risk. Wash your hands. 20 seconds, folks. Soap and water. If soap and water is not available, you can use a hand sanitizer, but soap and water is the best place for you to start. Avoid touching your face. Cover your coughs and sneezes. Clean those high-tech, high-contact surfaces. Back to what we just talked about. Keep those places that multiple people are touching, keep those clean. If you're sick, please stay home unless you've got to get to the doctor or you've got to seek medical care, and then call your doctor ahead of time so that they can respond appropriately when you show up. And then this piece that we haven't talked a whole lot about, but I think is really important, is how do you increase your personal resilience? How do you increase your body's ability to fight off infection? Quit smoking and vaping. Give your lungs the best possible chance they can. Coronavirus, COVID-19, primarily affects the lower respiratory system. Get your blood pressure under control. We know that those are two of the high-risk categories, lung and blood pressure issues. Increase the amount of physical exercise. This does not mean go out and run a marathon, but it does mean maybe go out and walk around the block or increase the level of activity. Get outdoors. If you can, spend about 15 minutes a day in the sun. That boosts the level of vitamin D that your body is producing, which is an important part of helping keep your immune system healthy. And then this one, which is really challenging, is improve your diet. As tempting as it may be to go out for me to get that vanilla milkshake with the Reese's peanut butter cups in it, this is the time to eat an extra piece of fruit or vegetables and try to stay away from the high-fat, high-calorie high-fat, high-calorie food. Be good to your digestive system, especially to the bacteria, the microbiome in your gut. They play a really important role in helping your body regulate your immune system and keeping you healthy. Feed them well, which is lots of fruits and vegetables and high fiber foods. Okay, we covered a lot of information about risk, about how to reduce that risk, how to increase your own personal resilience. This is science worth sharing. That's our tagline. If you feel that this is useful, please share it with those around you. Thank you for watching. I look forward to seeing you again. Take care and stay safe.